Meet Sophie, an event planner with a big personality, who loves romantic comedies, Thai food, and strumming her ukulele. She has a very active life, but always has to keep her disease in mind. Hereditary Angioedema, or HAE, is a disease of C1 inhibitor deficiency and gets in the way of her day-to-day, causing her frustration. Sophie has tried a few medications to treat her swells, but sometimes has to use more than one dose. Sophie wonders if there's another option. Sophie learned from her doctor that many pathways can lead to an HAE swell. A swell begins when a trigger, like stress, starts a chain of events. Think about a swell as a sink overflowing with water. The doctor explained that some HAE medications try to stop a swell by mopping up the water. But if the faucets are still on, the mop may not be able to keep up. If you give C1 inhibitor, you essentially turn off the faucet and treat the swell at the source. Sophie's doctor prescribed plasma-free Ruconest, a high-dose C1 inhibitor that's used to treat acute attacks of HAE in adults and adolescents. So why did the doctor prescribe Ruconest? Ruconest works by replacing the C1 inhibitor proteins her body needs, and in one study, it was shown to bring C1 inhibitor levels into the normal range in 94% of patients. Also in clinical studies, 97% of HAE swells were treated with just one dose of Ruconest. Sophie always has a lot going on with her job, so in talking with her doctor, she was also happy to hear that Ruconest stopped 93% of swells for at least 3 days after an injection, and the most common side effects were headache, nausea, and diarrhea. Sophie received free doses of Ruconest through the Ruconest Solution Starter program while they waited for her insurance to kick in. Then her dedicated Ruconest patient advocate came to her home and taught her how to administer an IV injection. Her RPA reassured Sophie that she could come back and train her as often as she needed. In a recent patient survey, about 85% of patients are confident to self-inject after training. Sophie is now trained and confident to treat at the first sign of a swell. 1 week later, Sophie threw the biggest event of her career, feeling confident with her Ruconest safely in tow in case of a swell. She's looking forward to better managing her swells and taking a well-deserved break before her next big event. What is Ruconest? Ruconest is an injectable prescription medicine that is used to treat acute attacks of hereditary angioedema, also known as HAE, in adult and adolescent patients over the age of 12. Important safety information. Do not use Ruconest if you have experienced life-threatening immediate hypersensitivity reactions, including anaphylaxis, to Ruconest or to any other C1 esterase inhibitor product. Call your healthcare professional or the emergency department right away if you experience wheezing, difficulty breathing, chest tightness, lips and gums turn blue, fast heartbeat, swelling, faintness, rash, or hives. Do not use Ruconest if you have a known or suspected allergy to rabbits or rabbit-derived products. If you do not have a known rabbit allergy, testing is not required. Tell your healthcare provider about all your medical conditions, including if you have a known allergy to rabbits. Tell your healthcare provider about any other medications you are taking, as some medications such as birth control pills and certain androgens can increase risk of clotting problems. Also tell your healthcare provider if you are pregnant, breastfeeding, or planning to do so. The most common side effect patients experience during clinical studies include headache, nausea, and diarrhea. These are not all the possible side effects of Ruconest. If any of the side effects get serious, or if you notice any side effects not listed here, please inform your healthcare provider or pharmacist. You can also report side effects to the FDA at 1-800-FDA-1088 or visit www.fda.gov/medwatch. For product information, please contact Pharming US toll-free at 844-474-2764. For adverse events, product complaint reports, and medical information, please call 800-930-5221. Please visit www.ruconest.com for full prescribing information, including patient product information.